The biggest exposure for a telemedicine provider outside from traditional medical professional liability is really the issue of licensure. Historically, a physician would be licensed in their resident state, maybe a neighboring state, now we see physicians licensed in numbers of states. But even with that, it's always a concern as far as them potentially treating a patient in a state where they're not licensed. And that can happen because the patient misrepresents where they are at the time of the encounter. Or another scenario we've looked at is a patient actually changing their state during the course of the encounter. Particularly here in the Northeast, where you've got states that are small and close together. I can cross from Washington, D.C. to Virginia to Maryland in about 5 minutes. So that could easily happen if a patient is mobile while they're having a discussion with a physician. And if a physician is licensed properly in Virginia, but they're not in Maryland, and there's a bad outcome, and the patient decides to bring action in the state of Maryland, a traditional malpractice policy would exclude that. And so we've actually built an exclusive Gallagher endorsement for telemedicine that addresses that licensure issue. So we can always talk about that. Another big thing is with physicians licensed in so many states now, because they're doing telemedicine, it brings about another concern, and that is with regard to disciplinary actions. The traditional medical malpractice policy will provide a sublimit of defense for disciplinary actions when a physician or other clinician is brought before a medical board, and their license may be in jeopardy due to some form of patient complaint. And again, that's always been a small sublimit of $10,000, $25,000. But now with physicians licensed in 30 and 40 and even some in 50 states, we've actually started to see claims where patients would send a complaint to every state where the physician is licensed. So that's a new exposure that we hadn't seen before. So we're having to really focus very heavily on adequate limits for disciplinary actions.